So, in line with that, we're going to bring our next guest on here. Let me get everybody sorted. Hello, Dr. Linares. How are you?
Hey, how are you, everyone? I'm really happy for having me here, and it's really exciting for talking about the POCUS.
Yeah.
Well,
Well, why
it's
don't
a
you
really
introduce yourself to everyone who doesn't know you and tell us where you're from? Again, this is really emblematic of the World Day. We're bringing the Americas to you. Tell us where you're from.
yeah, for sure. It's really emblematic because it's our the first time I think it's Latin America. Maybe be part of this war, the annual World Day of Regional Anesthesia and POCUS. I'm born in Colombia, but I live in Brazil, and a regional anesthesiologist also, and the currently coordinator of the division of point of care ultrasound in São Paulo Society of Anesthesiologists. And I'm really happy to talk about that. It's really an honor for me. I work with Steve in the ASRA recently, and you're both are good reference for me in regional anesthesia, and I'm so happy again, and really appreciate it all the be part of this.
I just cut out here. We just lost Luis. Hopefully, he'll join us back here in just a second. Not sure what happened there. Well, while we have a second here, let me just take a moment to let people know about a couple other things. I think he's joining back here. Hey, sorry we lost you there for a second.
No, it's okay. I think so. That was my connection, but it's everything okay. Thank you so much.
No, it's okay. All right. Well, I'm going to put your slides up and let you chat a little bit. So take it away. And there's your slides. You should be able to control those.
Okay. Yes, I am in control. Thank you so much. Well, thank you again for having me. It's a tremendously honor for me for be part of this congress, and for talking today about our experience in Brazil. We create the Brazilian expert recommendation panels, and it is really good for this part of kind of the learn or teaching. This is me again. Well, why does this matter globally? Why now POCUS? Because POCUS is clear, practical, and guidance at the bedside helps a team work safely. And when training and resources are really is not the same, no heterogeneous. Obviously, it's basic safety elements. It's simple to scalable frameworks, and the idea is aligned with the experience with other societies. In this kind was ESA, ESRA, and also Canadian Society of Anesthesiologists. This image is really fine because it's so good about the thinking about that, because POCUS at the first time for the oldest anesthesiologists is, well, we're going to learn to POCUS about now. Is this kind of tool help us? But well, it's pretty the same the AI. We need to maybe hug and understand a little bit more about that. What is our Brazilian context? The POCUS is present in many ORs and ICU, but the training exposure is really heterogeneous. We have a resource variability because sometimes in some ORs, in some places we don't have the device availability, or sometimes we have just one probe or linear or maybe convex and don't have a lot of probes, and the images archiving differ across the setting. This is really good point. We need to work a little bit more. Otherwise, is the high impact, because when you use POCUS for some cases, well, we can use for induction and for a hemodynamic instability or some emergencies also. What was our motivation? What was the reason to try to create a recommendation or Brazilian recommendation? Well, is this one of the logos for the World Regional Anesthesia Day? We want to create a little bit more equity, access, and relief from the POCUS in Brazil. The currently numbers we have in Brazil, in the Brazilian Society of Anesthesiologists, at least 40,000 of anesthesiologists between residents and assistants. And in São Paulo Society of Anesthesiologists, at least is close to 4,000 of anesthesiologists. And one of the motivations for create the first division or preparatory of point of care ultrasound in anesthesiology. In the past, we have some workshops in Brazil, and these workshops create some numbers. For example, we have at least for the year 2 or 3 workshops. We don't have any other workshops, official workshops in Brazil for anesthesiologists. And we train at least 276 participants. Was more males than females, and the maybe the biggest numbers for the participants we have in São Paulo, at least 138 of participants, and the others states in Brazil, we don't have a lot of training, or we don't have a lot of numbers about that, and this is will we be worried about that? What happened in Brazil? We will have the other numbers, a lot of anesthesiologists, and just this small piece, the small part of anesthesiology just training POCUS. And the idea that was maybe change the old way and create the new way. What is the new way? Well, the new way was create the Brazilian expert panel recommendations for perioperative point of care ultrasound in anesthesiology. And the idea was pick education, competency, and clinical implementation with that. How we did do that? For example, we picked 39 anesthesiologists. We picked 2 Brazilian anesthesiologists practicing POCUS outside of Brazil, 2 associated editors for ESA and ASRA. Steve was one of our help me a lot of for trying to create this recommendation, and 1 associated editor of ESRA also. And what was the idea? We tried to divide this document. First part was about core. What is core? Principles, ultrasound acquisition, clinical integration via AIM, gastric, focus, lung, diaphragm, and access, venous access and arterial access. And the second part was create the expansion, the emergent, maybe the part of our anesthesiologists, we don't have a lot of tools or pretty the same that the other colleague told, a lot of resources, of a lot of reference for talking about that. But we need to start to talking with that. It was this our way, regional and pain. We don't have, for example, for advanced hemodynamics, trauma, focusing cardiac arrest, optic nerve shift, and DVT. And we need to talk a little bit more about education also. We use maybe our base for AIM, obviously indication, the good acquisition for these images, interpretation, and medical decision, because we want to improve the numbers and improve the outcomes of our patients here in Brazil with POCUS. We obviously have a different kind of problems with the kit equipment and infrastructure, but the idea is we have to need to a car base or a laptop or tablet or more portable equipment in the OR, because we don't have a lot of ultrasounds here in Brazil. It's not our reality. We have amazing hospitals, amazing center of training, but don't have a lot of portable machines, maybe accessible for everyone. The idea was prioritize the portability, have at least three transducers, and share models between service, because we can learn a lot of for a different service here in Brazil or outside of Brazil. And for sure, maintains the sterile cleaning, disinfectation, and this kind of fire. We're trying to put this one. The other idea was to create a quick checklist for POCUS in Brazil, because we don't have maybe a certification, but we don't have a structure for this one. And what we wanted to do with quick checklist, for sure, we want to appliance located, maybe 24/7. Who cleans? Who do you document? Where do you save your image? Maybe in a PACS, maybe in a repository. Who trains? Who supervises you? Who do you accredit and revalidate the competence? And now we just have the ACA certification, and we have some workshops, but the idea is continue growing up and continue moving between the societies and maybe more practicing and more training for our anesthesiologists. And we think to think about the beyond the core. It's no more just the core, the basics, because again, we have a lot of uses in POCUS. And for example, we have a lot of high relevant applications. For example, trauma. We have an amazing center of trauma here in Latin America, and Brazil is one of them. Shock or venous congestion or cardiac arrest. Well, you're recently you have the Pearls. You have a course of pills, and you have the lecture for pills, and we have here in Brazil a Saba. Is pretty the same. Then this is the same idea, but we don't have at now we don't have POCUS. And why don't use POCUS in the cardiac arrest? Why don't teach this that? Why don't continue advancing it about the future? And obviously other target assessment we have with POCUS, but well, well, we can do that. We can go to advance at the next steps, where first of all, consolidate the core bundle, and the recommendation stay here for teachers. Okay, this is the recommendation. This we have for around the country, have a lot of anesthesiologists. Why don't you use the POCUS? And then the first idea was, okay, we need to consolidate, then expand according with the hospitals and surgical profile. For sure, not all the hospitals going to do the POCUS, but why not? And have a governance, accreditation, a assessment before hyper specialization, and use telementoring. It's pretty the same that the colleagues talk before. Well, I can do that for the telementoring and help maybe more places don't maybe more is no close than Sao Paulo, or don't close in and the big centers. The point here is define a minimum standard of care, and just it supports consist and a responsible practice. Otherwise, we have here the idea is because we have a lot of insufficient training. You see the numbers, you see maybe the structure of our some point that are really weak here in Brazil, but the idea is maybe explore more that, help use more teaching for that, pulling out for the gray zone, and maybe more accreditation and privilege and consent for this kind of focus. We're going to that, and documentation, more images, more storage for auditability and quality. The idea is the patients and the other colleagues see these images and improve the images for that. The proposed framework, which included three parts: at the knowledge, at the psychomotor ability, and the visual and spatial ability. The idea is the competency based in curriculum, for example, with the residents more practicing, and with a longitudinal assessment. Institutional accreditation also is for defining scope, oversight, and governance. Peer review and maintain of the competency, more training, more helping for the colleagues that we wanted to teach a little bit more focus, create this kind of recommendation, is create more literature, more lectures for help us. Equity, for sure, is one of the pillars of the Congress. Access to equipment and trying to avoid two-tier system. The idea is climbing safely. Not the first of all, not the guy is maybe with the kid. Is really the idea is going to structure training, supervision, and logbook, accreditation, documentation, and images, and KI and revalidation for this kind of images we're going to do. Our final message is we learn a lot with this kind of with this recommendation. POCUS is already present in Brazil and Latin America, and look at that. It's a huge country. We need to align language and security. HIN simplifies integration, question acquisition, interpretation, and conduct. Also, start with the core bundle. Maybe start to be more courage, or be more brave about it. Okay, we need to start with POCUS. Why? Because you see have a lot of good results, and what to do that with, maybe start with gastric, vascular, focus, and lung. Also scale with governance, training, accreditation, documentation, and QA, and thinking the equity, access to equipment and supervision in different scenarios. We open for teach a little bit more focus. We open for, and the idea is training more anesthesiologists for, with this kind of recommendation help us for, okay, this is we're going to start here, but the future is beyond, and guide and practice based in national and international recommendation that we have at now. This is the group of the team group that helped me a lot of with this kind of recommendation, and that's it. Thank you so much for having me here again.
Great, Luis. Thank you. It looks like you have some fans too. I was going to show some of the comments. Some people celebrating you. I'm not sure if these are colleagues or people that you've influenced. So people are watching you and appreciate your comments out there.
Yeah, I see that. It's really good. Know about that. Have some fans, but it's just for work. It's the people it's the people that are close to me that know we work hard with this part of
Yeah.
teaching in Brazil, because we have a tremendously anesthesiologists here. I really have some of them have a practice in outside of Brazil, doing training and come back. And what happened with the POCUS? One of the reasons when I live in Canada and come back to Brazil was, okay, what happened? Why is no POCUS our reality? POCUS is really help. I love regional anesthesia, pretty the same than you, but what happened with the teaching POCUS here is just few numbers. We have a lot of anesthesiologists. What happened? What is the next step? What did need to do for change our mind?
And I think that what you've demonstrated is that you can have passion, you can have enthusiasm, but until you have infrastructure, it doesn't sustain, it doesn't grow. It just is one or two people that are excited. But until you figure out the structure and the formula for how to propagate it, that's when you really get momentum, and that's really when the growth becomes sustained.
Yeah, for sure.
One of the main reasons the regional anesthesia is currently so popular is because it became mainstream. It became part of the core curriculum of training for residents and fellows here. So I think that needs to happen with POCUS too. It has to be curriculum.
I agree totally with you. We need to create the POCUS with a big part of the residence training. I'm really happy for the society, Brazilian society and Paulista society, maybe hug my idea and, okay, we need to change. This is the good point at now. We're trying to put in a little bit more exposure, our residents, our anesthesiologists. And in this document, I pick a lot of anesthesiologists around Brazil. It's not just one state. It's a lot of and outside of Brazil, and for sure some mentors, internationals, and was Steve and was Josh Zimmerman was really good, because it's the idea. It show us, well, maybe this have your weak. You are weak in this point. You need to evolve in this point, because when you stay here, you'll see your reality. But sometimes the other scopes really is really good for help us.
Thank you so much, Luis. We're really excited to see about all the stuff that you guys are working on. Hopefully we'll see some of this stuff presented at the meetings, ASRA, ESRA, and I think the Latin America is going to be hosting the international conference in 2027. Yeah. So we're excited about joining you guys in South America soon. So thank you so much.
For sure. You're totally welcome. Thank you so much.
Great. Have a wonderful day.
You too. Thank you so much.